time that we've not experienced or witnessed before. And 3, never before has testing been so high in the political agenda everywhere. So this is truly a unique moment in time for testing. And here we are today to talk about how to seize this moment. We know, for example, that after a coal mining accident, a mining town would invest heavily in state-of-the-art emergency rooms and ICUs, an infrastructure that may never be used. So in the context of another emergency, like the pandemic that we've experienced last year, we have seen also a massive increase in the diagnostic manufacturing capacity. But keeping that manufacturing capacity as a warm base during peacetime is going to be a pretty costly exercise, as we know. So there's now an opportunity to preserve some of that capacity for testing that is urgently needed to tackle other major epidemics that by no means are yet under control, such as TB, malaria, and others. We can rebuild for pandemic preparedness, but this time shouldn't be done in isolation. As Dr. Tedros said earlier in the pandemic, universal health coverage and global health security are two sides of the same coin. Now, sustainable, resilient health systems depend on balancing those two sides of that coin. We now know that the country wealth was not a real predictor of pandemic success, but rather was the implementation of public health measures that kept both morbidity and mortality at a minimum. So countries with strong health systems overall had done much better. Now to FINE and a little bit about the history. So in 2003, since 2003, FINE has been working to bridge the product development gaps for essential diagnostics in collaboration with international research community, the public sector, as well as industry. Last year, FINE, many of us, we stepped into the forefront of the global pandemic response, co-leading the diagnostic pillar of the ACT Accelerator, alongside with colleagues from the Global Fund and WHO. And I'm happy to see here today both Dr. Tedros addressing us as well as Peter San, who will join us shortly. Today, it's only 475 days after COVID-19 was declared to be a public health emergency of international concerns. We're launching our new strategy today, a strategy that was developed during the pandemic. And during this process, we learned many lessons, both from the ACT Accelerator, as well as what had been built through the last 2 decades of experience in other infectious diseases. I've been part of many discussions recently as well, and it's becoming clearer to me that there's much need for a diagnostic alliance capable of addressing end-to-end needs, from R&D on one side to access on the other. And what we are trying to do is build from our PDP heritage and many of the lessons learned through the ACT Accelerator framework to maximize the impact with an alliance model in mind. So by pulling our expertise, by working as partners in an alliance, we can bring cutting-edge diagnostics to market faster, at scale, and give, as I said earlier, these eyes and ears approach, an approach of high priority in national health programs. Our strategy is ambitious. It aims to have high impact. And by the end of 2023, we expect to have at least contributed to 1 million lives saved, as well as saving up to about $1 billion to health systems and patients. So thank you again for joining us today. I'm really honored to be sharing this virtual stage with so many distinguished guests and friends, including our Goodwill Ambassador, Dr. Aminata Traore. With these events, we also are calling on global leaders at the Global Health Summit later this week to ensure that diagnostics and testing underpin the forthcoming Rome Declaration, a key event to be launched on this coming Thursday. So Sarah, with that, it's over to you, and thank you very much for the opportunity.
Thanks, Sergio. That's a really good way of setting the stage. To further set the scene, we also have Dr. Tedros, the Director General of the World Health Organization, who provided this keynote address.
Esteemed guests, dear colleagues and friends, I offer my warm thanks to FIND for hosting today's high-level forum. The COVID-19 pandemic has shone a light on the important role of diagnostics and lab services in creating and maintaining strong and agile health systems. Over the past year, access to fast, accurate, and affordable diagnostics have helped to interrupt disease transmission and track the effectiveness of public health interventions. The Access to COVID-19 Tools Accelerator has demonstrated the power of partnership for rapidly advancing diagnostic testing, product development, and evaluation. We have created partnerships to expand diagnostic testing worldwide. We have leveraged integrated lab networks to help maintain essential health services. Still, vast disparities persist between high-income and low and middle-income countries. To tackle this inequality, health systems must be strengthened to enable countries to respond effectively to diagnostic information. We must strengthen the multilateral system, making diagnostics a key part of health system development and emergency preparedness. Without diagnostics, we're flying blind. I welcome this high-level forum and urge all governments and partners to invest in diagnostics as a critical component of health. Working together, we can build a healthier, more resilient world. I thank you.
Thank you, Dr. Tedros, for that. It's always great to get your insight on the subject. I think we should all keep this idea that without testing, we're flying blind at the forefront of our minds as we go through this event. Next, though, I want to introduce Peter Sands, who is Executive Director of the Global Fund, a co-convener of the diagnostics pillar of the ACT Accelerator alongside FIND. Peter, over to you. Thanks for joining us.
Hi, I must start by both thanking you for joining you and for enabling me to speak, but also to apologize. I'm in a car in a rainstorm, so you may have a little bit of background noise. Let me start by saying that over the last year, I have learned more about diagnostics than I ever expected to learn. And that was because of the partnership that the Global Fund and FIND had in co-leading ACTA DX. And it's been a very productive partnership. We've encountered many challenges, but I also think we have learned a lot about the way different agencies can work together to solve problems in real time. COVID-19 has both highlighted the critical importance diagnostics play in pandemic response, but also in the response to any infectious disease. But also it's exposed, and I think Sergio touched on some of these, some of the weaknesses we have in our approach to this vital part of the medical toolbox. From the start, diagnostics played a vital part in the response to COVID, whether it's understanding the spread of the disease, underpinning public health measures, such as test, trace, isolate, or border control. Of course, it's about case management, identifying who to treat. It's played a vital role through regular testing of health workers, ensuring infection control in health facilities to reduce nosocomial infection, but also to protect frontline health workers. It's now playing a vital role in safely opening up vital facilities such as schools or particular essential services. And then most recently, with the emergence of variants, the spectrum of diagnostics is playing all the way from basic disease identification and pattern recognition through to genomic surveillance and sequencing in terms of identifying variants of concern and potential vaccine escape. And there have been some great successes. I actually think the speed of identifying PCR tools very quickly in the pandemic, the speed with which automated PCR was made available, the speed with which we found high quality antigen RDTs are actually testimony to the scientific and production capabilities of what is a very fragmented industry. Yet against those successes, what I would say, and again, Sergio has mentioned some of these, there were manufacturing capacity and deployment constraints on basically every element of diagnostics, including really basic things like swabs, let alone automated PCR cartridges. Second, we've encountered significant quality issues and inconsistent standards and evaluation approaches, which have undermined the quality, the credibility, particularly of antigen RDTs in a way that is still creating problems for us all today. Third, I think there has been and still are inconsistent messages about the way we should use different diagnostic tools, the different use cases, and there's lots of confusion and misunderstanding still, for example, around antigen RDTs. Fourth, there have been pervasive issues of local capacity. Again, there have been some great counterexamples. The Africa CDC is a really good counterexample, but many countries have struggled with laboratory capacity, the ability to actually implement testing strategies of different types. And I think one of the things that has come across is the upside from addressing a range of these issues, not least massive upside in terms of untapped scope for innovation, whether it's in self-testing or low-cost point-of-care PCR or multiplexed diagnostic tools or automated digital linkages, so that if people are self-testing, the vital data is getting uploaded in a very cost-efficient and seamless manner. One of my big takeaways as the executive director of the Global Fund to Fight AIDS, TB, and Malaria, not actually COVID, although that's obviously been absorbing a lot of our attention over the course of the last year, is that actually we need to up our game on diagnostics on the other diseases as well. For TB, we're the biggest single issue to beating the epidemic. And remember, TB is the second largest killer after COVID in the world. For TB, getting low-cost point-of-care PCR diagnostics that allow you to identify TB quickly, including drug-resistant variants, would be transformational in fighting the disease. In HIV, I'd say the big area of interest and development is how you enable self-testing, but also the linkage into enrollment into treatment. So you don't have the drop between those who test positive and those who enroll in treatment. And for malaria, I think the most natural and one of the most powerful areas of development is how we move a lot of the case identification from being a yes/no question on whether or not a child with a fever has malaria to a more multiplex diagnostic solution, which is more about febrile management. And that, of course, is also incredibly powerful in the context of future pandemic preparedness. So when I look at this space and reflect on the partnership I've had with FIND over the course of the last 15 months or so, as we've combated COVID, I really see an important role for FIND to play across this value chain, across the ecosystem, to ensure that we have better, more innovative, cheaper, more widely available diagnostic tools, that there is a better understanding of how to use them and integrate them into either case management or public health strategies. And also that the partnership works even more seamlessly. So organizations like the Global Fund, which are all about deployment at scale, are very plugged into an understanding of what's coming down the pipeline in terms of diagnostics. And organizations like FIND are fully informed as to what's really needed and what would make most difference from a fighting a disease point of view. So I'm delighted to see the new strategy for FIND. And I also want to thank the team at FIND for the partnership the Global Fund has had before COVID, yes, but immeasurably deepened by the experience of working together during COVID. And I think you have a very, very full agenda and a very important role to play. And one of the important strategic challenges you will face is frankly around prioritization, of working out which aspects of the quite kind of chaotic diagnostics landscape are the ones that will actually deliver most benefit in terms of saving lives and protecting people from future threats. So thank you very much.
Peter, I think you muted yourself too soon.
Oh, sorry. That was, well, I don't know where you lost me. I was just going to say thank you for the partnership, for the work you're doing. And I congratulate you on your new strategy. You have a huge role to play, both in saving lives now and protecting people from future threats. Thank you.
Thanks you, Peter. Sarah, over to you.
Thank you very much, Peter. That was really useful. And I think it's striking that so many of our initial conversations have emphasised partnership, how far we've come, but also how far we've got left to go. So with that all in mind, let's head to the next stage of our discussion. So we're going to be talking to a range of experts. Make sure you stick around though, because afterwards, Dr. Aminata Touré, who is the former Prime Minister of Senegal and a Fine Goodwill Ambassador, is going to outline those recommendations that we mentioned earlier. So with that, let's dive into the panelists. Keep your questions coming and keep the conversation going on social media with the Transforming Testing hashtag. But I'm really excited to introduce our first panelists. Each one is going to speak for about 5 minutes, and then we'll, as I say, dive into questions. So Peter Ngola Awiti is the Executive Director of Woke Youth Development Projects, which aims to improve knowledge and behaviour of young people in Kenya to prevent the transmission of HIV and AIDS. Peter, the floor is yours. We're looking forward to it.
Yeah, thank you very much. And I'm very happy to join other panelists in the role of community in all these diagnostics across the diseases. The community plays a very important role, particularly because it's the first level of healthcare. I remember when I was growing up, my mom, wherever I have fever or shivering, my mom would tell me to pass urine in a basin. And if the urine is very concentrated and a fever, should take me to the hospital because I come from a malaria-prone area. And that was a local diagnostic. That gives the community the importance of diagnostics. Many years later, in 2013, there was a United Nations launched the 1 million healthcare workers campaign. And this was strategically meant to support the professional healthcare workers, to train 1 million lay workers to provide services at community level. And in this area, we also saw Global Fund coming up, particularly in C19 RM applications, supporting community engagement so that they are being able to do diagnostics. But these diagnostics, in spite of the fact that they have been successful, most of the diagnostics are still being at the point of care. We have seen that particularly in TB, where the first point of diagnostic is the PCR, the gene expert, which again has been very expensive for low and middle income countries because of the $20 per cartridge. Even though the price has come down, the campaign is still on to $5 per cartridge, which has not been very successful with Cepheid. It is in this respect that we find that the communities should be given an opportunity to use science and technology to do diagnostics, because most of the times they are doing only screening. Fortunately enough, HIB has gone further ahead to have self-testing kit, and that is now very user-friendly at the community level. TB has not been very successful in this area. On COVID, the community has been surcharged because there is not widespread use of antigen diagnostic, rapid diagnostics test at community level. We still have a lot of pile-up at border centers because it's only the PCR that has to be used in this diagnostics. And that means there has to be need to develop wider spectrum of diagnostics and use science at community level, because the community is the first point where the diagnostics should take place before, with a very well-knit referral system for confirmation at healthcare facility and also enrollment into treatment. We have had very good success at community level, where the community, some task has been shifted to communities, like sputum transportation, triaging at the outpatient dispensaries, health education at community level, social marketing, particularly in COVID. Most of the masks were being marketed by communities at community level at a very affordable cost. And lastly, the testing should be made accurate. In this respect, what are the lessons that we have learned from COVID? When the pandemic struck in 2020, the community was turned into the enemies of the response. We find most of the response was transformed into into police, into the hands of police enforcement, where the community health volunteers were being arrested for being out late, or for some areas being blocked out for community health workers. And therefore, we did not take advantage of the community health workers in the response to COVID-19. We know police cannot arrest everybody. At the community spread level of COVID, it is now the community, the healthcare has to be transferred to communities so that they respond adequately. We should plant into the community the culture of health, so that the communities can able to manage their own health, and only goes to the and that will help us to reduce diseases like diabetes, like high blood pressure, because the community will be able to be part of their health and able to respond to their health. They are able to use available diagnostics to know when their sugar level is high. They should be able to know when they have a fever and what kind of fever they are. We need to equip the community well in advance so that they can be able to respond to some of that primary healthcare issues. And lastly, we need to be partners with the communities, because we cannot enforce laws within the communities if we don't support communities to provide the relevant diagnostics and make a well-sounding referral system. That is what we envisage to have the community. And I want to put my thanks to Peter Sands for the C19RM funding, which most of it is going to support communities into meaningful engagement. And we look forward to a community response that will eliminate TB, HIV, malaria, and lastly, COVID. Thank you.
Thank you so much, Peter. I think it's striking, you're right, it's not just about the tools that we have, it's about how we use them and how we roll them out. But we'll probably come back to that in the questions. I now want to pass over to Jayashri Iyer, who's the Executive Director of Access to Medicine, which is an organisation that works closely with the pharmaceutical industry to encourage them to do more of the types of people that you're talking about, Peter, those living in low and middle income countries. So Jayashri, over to you.
Well, thank you for inviting me to this important discussion, and hello everyone. So, I mean, as Sarah mentioned, I work for the Access to Medicine Foundation. We've been for about 15 years, been tracking the pharmaceutical industry on access issues. And while we're called the Access to Medicine Foundation, we work more and more with medicines, vaccines, and diagnostics. So we've got companies such as Roche, Merck KGaA, and Abbott, and we look at their work in increasing access to their current marketed diagnostics and technologies needed for diagnostics. And we encourage more companies to invest in diagnostic development and access. What we also do is we leverage policies of governments. So governments invest more in cost-effective ways to improve diagnostic testing, access, and development. And importantly, what we look at is also an increasing engagement by institutional investors. So these are investors that invest in the pharmaceutical industry and the diagnostic industry to ensure that their investment in global health priorities are supported, and eventually we get equitable access to the key commodities that are being developed by these companies. So at the moment, we've got about 100 institutional investors that support our work and use it. Now, a couple of reflections on what we've learned from COVID that has helped us plan for the future, us being society. And I'm very happy to see that many of these elements are in the new strategy of FIND. I think what we've seen is that the real issue in many countries is the limited testing capacity. And even when tests are there, they don't always get used or optimally used. And even if they get used, they don't always get reported. Even if they're reported, the right treatments may not always be available for patients who need them. So this tells you that this is not only an issue for COVID-19, but really an issue that we start seeing in many other disease areas. Some of my colleagues have mentioned tuberculosis, malaria. We're starting to see this also in a lot of non-communicable diseases. So I think when we looked at our data last year, we saw that around middle of 2020, fewer than 1 in 5 health facilities across the continent of Africa had access to COVID-19 tests. So it tells you that basically that access is not particularly a given in any component. What COVID-19 has done is it has exposed sort of the impact of years of sort of neglect in testing for all diseases, with kind of diagnostics being one of the weakest links in the care cascade in conditions ranging from HIV to TB, diabetes, hypertension. And at the end of it, it is the people living in low and middle income countries that are disproportionately bearing the burden of this. So I'd like to kind of talk a bit about the diagnostic industry. It's clear that the diagnostic industry has a responsibility, but also when you think about it, an opportunity to engage in global health in a more active way. They definitely have seen that companies and their investors have increasingly recognized the need to partner and to have the right tests available for access. Companies have also started recognizing that they can't sell their drugs if patients are not coming to hospitals and being safe in that sense. So this goes for any medicine that they're trying to sell. So that increasing recognition from the industry is something that we've seen in our data. But at the end, you still see very limited investment. But more and more companies are looking at key areas where they're looking across the whole continuum of care. I'll give a couple of examples. Roche, for example, has been working across the different continuum of care for breast cancer and HIV, partnering with many organizations to make sure that diagnostics and treatments are available side by side in the health facilities that they work with. Novo Nordisk works with Roche on certain facilities to make sure diabetes testing is available alongside their treatment. And more recently, with sickle cell disease and the involvement of Novartis and some of their partners in access. What I think is really an important thing to note is that for the past 25 years, we've seen many large players leaving infectious disease research, unearthing a more awareness, but also a role for biotech companies. But then at the end of it, the financing availability, production capacity, and the ability to bring innovations really to global markets becomes low. So at the end, you end up seeing more public spending. And this is, of course, true. On top of that, of course, we have an extremely fragmented industry, and we're just looking at the diagnostic industry in its own, with many sort of large players, with few large players and many small players across the whole world. So how do we make sure that they all remain engaged in investing in diagnostics is an important aspect for us to look at when we think of future pandemics. So how do we do that? I think one of the first steps has already been identified as making sure that we assemble and identify priorities, what needs to be done. This includes not only the priorities when it comes to the components, so how much of point of care testing do we need? Are they simple enough to use in resource limited settings? There's a lot more engagement in target product profiles so that the right product is created for the right diseases and for the right patients. We have in the last Access to Medicine Index been looking at some data where the World Health Organizations and Policy Cures research have identified over 200 specific medicines, vaccines, diagnostic tests, and other products that are urgently needed by people living in low and middle income countries as a call to action to say these are the areas where we need to see investment. And what we found in our data is that 149 out of these over 200 priority gaps go completely unaddressed with no investment at all from some of the 20 biggest companies in the world. Of course, as I said, there might be a couple of diagnostic companies and other smaller companies engaged, but you really expect some of the big ones to get involved in this. And and of course, at the end of it, it's not only about investment into R&D, it also, at the end, needs to be accessible. And what we know is that diagnostic testing and LMICs need to be cheaper, faster, reliable, and easy to use in the field. And but equitable access for the whole world is not a given. By nature, when you have a product, it's not only a given that the product is going to be made available for patients that suffer the highest burden or across the board in the whole world. So not only do we need R&D of testing and digital tools to track, record, and trace, but we also need equitable access covering areas such as affordability, making sure that there's adequate supply around the world, reducing the dependency of supply coming from one or two players who are the main producers, making sure that workforce and infrastructure is actually available and constantly invested in so that it is maintained across longer periods of time. So I think I'd like to just mainly conclude by saying that the decisions that we make today as a society, I think, have a real big implication on access downstream. So we've always been a strong advocate for early access planning and the public investment going into cost-effective solutions such as product development partnerships, such as FIND. I think we've seen that working with product development partnerships has increased access and coordination in both financing and investment. And finally, at the end of it, leads to more products reaching to patients who really need them. So we've actually seen that there are mechanisms that luckily have been invested in for many years. In diagnostics, there has been organizations such as FIND. In vaccines has been Gavi, CEPI. For medicines, it's been Global Fund. And if we didn't have those sort of investments for the last number of years, we wouldn't be where we are today, even with COVID-19 in that sense. So I think that we definitely have seen an increasing role, but there are some concerns in basically making sure that more industry engages in access. Because how can we prevent another epidemic or a pandemic if we can't even identify or prevent it? Thank you.
There's a lot of work to be done, is the message I'm getting from you. We've made a lot of progress, but we should not rest on our laurels. I think that's probably quite good as we look at the fine strategy. Next up, we have Dr. Sarah Cerdas. She's a member of the European Parliament from Portugal. She's a medical doctor, sits on the Public Health Committee of the Parliament, and is a vocal activist on issues surrounding access to health. Unfortunately, Sarah can't join us directly any longer, but she sent us some remarks via video, which I think we're about to see.
Hello everyone, Sarah Cerdas here. I'm a member of the European Parliament. I would like to start by thanking FIND for inviting me for this high-level forum on diagnostic testing. We need to understand that COVID-19 pandemic showed us the vulnerabilities we have in regards of not only data, but also on supply of products, supply of medicines, medical products, and also availability and manufacturing capacities along the globes. There's many lessons learned from the pandemic, and I would like to highlight a few of them. First and foremost is something that is quite bluntly there, but it needs to be said, which is member states need to work together and have a coordinated response. And this is needed in order for us to increase our efficiency, because our health resources are limited. All around the globe, our resources are limited. So if we want to tackle a global virus, a destroyer of health systems, we need to have a coordinated response. And for this, we need better preparedness and response for future health threats. We need to support the creation of stockpiles of essential medical products and increase the accessibility worldwide, not only to medicines, but also to testing and diagnostic equipment. For this, we must work to increase the quality standards for everyone and improve the universal health coverage. We must not forget we're going through a crisis, through a pandemic, but we still want to reach the goals for the Sustainable Development Goals in 2030. And we will do this only by working together, by investing in strengthening our health systems, making them more resilient, and also not forgetting the core of our healthcare systems, training our healthcare workforce and making opportunities and making their work conditions, improve their work conditions as they need, as they were very strained by this pandemic in the last in the last months, but also the last year. Talking a bit about the response by the pandemic by the EU, we have that the European Commission created a team to respond to the outbreak, to support the research not only on vaccines and diagnostics tools such as tests, but also for treatment. Also issued the guidelines on measures on how to stop the spreading of virus. This was done by the ECDC, our technical scientific body. Also, the EU has worked into the repatriation of EU citizens when the pandemic first hit. And something quite essential, it provided funding through the Coronavirus Response Initiative and through liquidity of the European Investment Fund. What does this mean? That we're going to a sanitary crisis, a health crisis, but also that brings with it a bigger social and economic crisis. And lessons learned from the 2008 crisis is that we cannot meet economic setbacks by cuts. So in this regard, we invest money on families, on companies, in order to save jobs and guarantee the finances of our families and companies, and we protected jobs. We did this through the SURE mechanism, and this was very important not to increase the unemployment rate. We also, the EU is also committed in ensuring universal access to COVID-19 vaccines through the COVAX mechanism. We have been one of the biggest donors. I want to stress that it's important that everyone contributes to this COVAX initiative because as we see it right now throughout the globe, we see quite an unequal distribution of vaccines. Some low and middle income countries still are struggling behind to meet their vaccination rates, especially the most vulnerable groups are still not protected. And these vulnerable groups is healthcare workers. So there are still parts of the world where healthcare workers are fighting the pandemic on the front line and they are not protected from the virus. So I would like to just increase and raise this pledge to all states to donate to COVAX mechanism. And I would like to highlight something that Dr. Tedros stated yesterday, that instead of starting vaccinating teenagers, which we know are not on is not a risk group for COVID-19, we should, member states that have this capacity should donate for the COVAX mechanism. What the EU did in order to respond to the pandemic? Something that we worked very, very hard was on making health a priority, and we worked on having a true European health union. This was done through the EU for Health, which is the health program for 7 years. It's the first standalone health program, and it was needed a pandemic to have a standalone health program in the EU. And we have 5.1 billion in order to invest to health promotion, disease prevention, health threats, international collaboration, and better accessibility to medicines and medical products. All of this in a health in all policies and a One Health approach. This is very important for us to have a convergent way of dealing with the health topics at the Union. Other tools that we have in our regard is we're going to increase the mandates of the ECDC, of the EMA, to strengthen the EU response to cross-border health threats. There's already the HERA incubator ongoing, which is quite an innovation, and also the pharma strategy and the European Beating Cancer Plan, which is something that, if worked together, can also tackle other non-communicable diseases. So politicians and policymakers now understand the true value of health, and that health cannot be dissociated from all the other social determinants. For this, it's important to invest in health in all policies, as all policies will have a huge impact in everyone's life, and especially having the health perspective, not healthcare, because health is more broad than healthcare, the health perspective on all policies that is done. So I would like just to finalize stating that this is the moment to build bridges, to involve all stakeholders in the discussion, and for this I would like just to stress the needs to improve the access to diagnosis on COVID-19, because this is the first step for us to understand what we are dealing with, what is the momentum, what is the status of the pandemic. So I would like to thank you everyone for inviting me here, and thank everyone for the discussion and for bringing more awareness to the need of investing in diagnosis and in testing for COVID-19. Thank you very much.
Well, thank you, Sarah, for that very thorough overview. I think there are some key themes emerging around access not being inevitable, and that, you know, the pandemic really has demonstrated the importance of health. Next up, our final panelist, just for a couple of minutes before we get into the questions, is Dr. Hayat Sindhi. She is the Chief Advisor for the Islamic Development Bank, which aids the development of its 57 member nations across several sectors, including science, technology, innovation, and health. So Dr. Sindhi, a couple of minutes for your opening thoughts.
Thank you very much. Thank you, Sarah, for your kind introduction. Dr. Sergio Carmona, the acting CEO of FIND, Dr. Aminata Toure, FIND Will Ambassadors, and Dr. Tedros, and distinguished guests, panelists, ladies and gentlemen, Assalamu alaikum wa rahmatullahi wa barakatuh. Good afternoon from Jeddah. It's really my great pleasure on behalf of the Islamic Development Bank Group to express my gratitude really for inviting me to this important, especially to me, roundtable to discuss the diagnostic lessons learned from COVID-19 and how we can prepare for the future pandemics, and how wise access to testing is a fundamental to achieving the global goal of universal health coverage. I would like to spend a few minutes to share with you how ISDB did response and last year, and of course continuing responding this year. But before I start talking about ISDB experience, listening to the Sergio and Dr. Tori and Tedros and Peter and Sarah and Peter San, for us, the lesson learned, of course, from our experience as a scientist and from ISDB experience and as also biotechnologists, it's come to that we all agree that the lesson learned from COVID-19 that the vital role of locally developed innovation and transfer of technology is a must to fight this COVID-19. Also, from the past epidemics and listening to Sergio and Peter and Tedros, without appropriate diagnostic tools, devices, therapeutic and vaccine, we cannot fight this, we cannot control this, we cannot contain this. So we need that. And also the current manufacturing capacity, especially in the developing countries. As you know, ISDB look after 57 countries, 21 of them least developing countries. So the manufacturing capacity is far off from meeting the global demand and also the local demand. So from that, we come also the conclusion that we need to strengthen the global partnership to encourage and leverage locally developed innovations and facilitate technology transfer for strengthening global supply COVID-19 diagnostic and be prepared for the future pandemic by leveraging and building manufacturing capacity in member countries and of course in least developing countries. So what would you do last year? How the Islamic Development Bank reacted toward this? First of all, in the beginning, ISDB helped its member country by coming with a special package, what we call it the 3 R's package, which is response, restore, and restart, and is about $2.3 billion type of financing facilities. And that's going to help to preventing, containing, mitigating, and recovering from impact of COVID-19 pandemic. And also with that, we have a new blended finance innovative model, what we call it 5Ps, which is coined by His Excellency Dr. Badr Hajjar, which is 5Ps is for public, private, philanthropy, people partnership. And that's to adopt and to ensure the success of the program. And as you can see from all the stakeholders involved, so all the 5Ps have a critical role to play in terms of co-financing, implementation of modality, networking, and supporting manufacturing capacity to strengthen and tie between the demand and supply. So that's what we did, and also to strengthen the technical development and innovation. Which is a vital component, as we agreed from the start, to overcome the pandemic. We dedicated the Transform Fund call for innovation last year. We challenged the whole scientific community around the world, research institution to come with. From the start, we recognized diagnostics importance, so we challenged the whole community around the world to come with the low diagnostic, new innovative idea from local communities. We also asked them to come with the better understanding how we can, encourage the capacity building within the whole health value chain. And luckily, through the Transform Fund, we received about 4,700 interest. We picked from that top 30, and you can see that we go through rigorous type of selection, and of course with help with Alan, he's amazing, and WHO and PATH, they went through and to select the best innovation. And because we understand the role of global partnership, we are partnering now with WHO to mainstream these ideas that we picked through their own offices and capacity. And I just want to give you two examples, Sarah, I know the time, but it's nice to see a practical and a real example. So one of the examples that we sponsor molecular diagnostic and DNA testing platform for healthcare delivery in Nigeria. Because as you know, Nigeria is over 200 million, and this is an innovative solution, connect hospitals, clinics, medical labs, academics, and researchers to specialize molecular diagnostics and DNA testing through a robust supply chain within national-wide footprint in the whole Nigeria. Another example quickly is an amazing portable dual energy X-ray detector that can be taken to the patient for monitoring COVID-19 infection. Also, it can determine the right time to put the COVID-19 patient on ventilators to optimize both ventilator usage and patient recovery time. And also it can help to confirm through imaging whether the patient is responding or not. And this is going to be in the whole, in a way, in Pakistan. Another thing I wanted to emphasize here, and listening to Peter San and Peter and Sergey and Sarah, is that we identify to strengthen our global partnership with the health field. So we identify a certain partner, and they're going to address two major solutions. For us, I think all of you agree, and all of you know, one of the first solutions that identify we need to really address is how we're going to strengthen the national labs system for priority medical testing, like, for example, malaria, HIV, HPV, HIV, COVID-19 within our member countries. And we were doing that with the halters. So we're going to have like a roadmap for selected countries, tell us what is the priority disease, how we can also the 5 blending finance model help for affordable availability of testing capability. And I can go that later on with more questions. The second solution, also implementing in partnership with PATH, similar to address these challenges, but this time we're focusing on the diff market analysis to build a robust evidence-based capacity building and investment framework to support ISDB member country to identify high impact investment that can be leveraged to build local manufacturing capacity. And that's very, very crucial because we don't know who is the right partnership. And a lot of our membership, they ask for help. So we need to really partner with the great global partner to really identify that. Finally, I wanted to also mention to you, Sarah, and to the rest of the guests here, we also tackled the root problem. We devoted part of our scholarship program with the World Academy of Science to help give a scholarship for strengthening the health system within our member countries. And what we're doing this year, we know about the inequality distribution of the vaccine. So we developed what we call it ISDB Group Vaccine Access Facility. We call it IVAC program. And this IVAC program will help to adopt holistic approach to providing access to COVID-19, focusing on phases of health supplies development, manufacturing, delivery to its beneficiaries, and at the same time ensure long-term self-reliance through technology transfer and capacity building. And this year, we dedicated also the call for innovation, the 4 call for innovation for Transform Fund on building resilience through innovation in response to COVID-19 pandemic. And the aim to identify, we also challenging the scientific institution and research lab to identify and leverage the scale up of innovation solutions that relate to the procurement, development and transfer of innovative technology that can contribute to boosting local manufacturing capacity of ISD member country for production of COVID-19 vaccination. So my concluding remarks, Sarah, and to the rest of the panel, thank you for giving me the time. I hope this discussion, because I said, you know, how the ISDB look at the matter, and we tackle all the angles, really. Innovative financial solution, listening to our member country, talking to innovation, talking to scientists, tapping to the scholarship, tapping to the local, innovation, and also have a great partnership. I hope this discussion will really help to strengthen the R&D and manufacturing capacity within the developing countries, especially in the least developing country. But of course, we cannot do that alone. That's why we're having this seminar. That's why we need to have the right partnership. And through the Science Technology Department within ISDB, and I just want to let you know, we are the only multilateral bank have Science Technology Innovation Department. We hope that we can identify great partnership like with FIND, with WHO, with Ellen and with you, Sarah. You know, you're a great, will be facilitated for making awareness of this, and to hope that we are committed, ISDB, to find the right countries, identify the right countries within our member country who has the potential to have their own manufacturing capability within our own country. And we are committed toward expanding diagnostic manufacturing to achieve a new public health order for its health and economic security. And thank you again for giving me the floor.
Well, no, thank you very much, Hayat. That was a really interesting overview of the work you've been doing and the challenges that you faced. We have about 10 minutes of questions, and we've got loads of questions. So I'm going to ask the panelists, please try and answer with just one or 2 minutes your key thoughts with the questions. So I want to get through as many as possible. I'm going to start with Jayashri. There have been some questions about how we ensure that testing also tackles variants. That's really becoming increasingly apparent in the second half. What are your thoughts on what do we need to do to strengthen real-time surveillance and mass testing to ensure that we nip these sorts of new variants or hotspots of existing variants in the bud?
Yeah, thanks for the question. So I'll speak from my capacity of looking at how industry and global health players work on these kind of issues. I think that there's a lot of barriers that that's already been identified and has been identified also before COVID and now during COVID. I do think that making sure that there key organizations who are working alongside making sure that these barriers are being addressed alongside the availability of testing. It kind of goes hand in hand. So I think there's a few key things that we need to look at. We definitely need to look at financial investment into capacity and infrastructure development. We need to look at better validation of testing and better validation of laboratory and trained healthcare workers who are able to do the testing properly. And I do think that that financing model must come from multiple sources. It cannot all come directly from industry or only for the public sector. It must be a mixed bag that comes to invest in this particular space. So I thought that would be my main intervention in this short amount of time.
Thank you very much. Yes, I wish we had more time to discuss. Sergio, I think, is here too, and there's a question for him about FIND. Is FIND committed to both attract more investors and actors upstream in the development process, but also place conditions on that process and our research and development, especially when using public financing to ensure equitable access downstream? What would you say to that, Sergio?
For sure. So FIND has been working hard in this pandemic also to diversify its pool of funders, and very much in the conditions that we put equitable access. So and not to leave anyone behind. So it is part of the key conditions of those investments, access.
Well, I've got you actually as well. There's a question about non-communicable diseases being responsible, for 70% of deaths worldwide. How is this going to be involved in the next stage of your strategy, and what gaps exist in terms of creating diagnostics to tackle non-communicable diseases? How are we going to address that?
Yeah, it's a tricky question. I mean, FIND has in the past and until now been very much focused on infectious diseases and high burden causes of mortality. Obviously, comorbidities do include non-communicable diseases. And in the context of COVID, we've seen how, for example, those who suffer of diabetes are at high risk of both morbidity and mortality. So in the context of comorbidities, FIND is certainly looking at leveraging of the 20 years of experience in infectious diseases to make sure we treat the patient as a whole with its comorbidities associated with the infectious diseases. So it is part of that strategy.
Makes complete sense there, Jules. Peter, kind of building on that, but moving back to infectious diseases, you talked a lot about tuberculosis in your initial comments. What lessons do you think we can learn from coronavirus to apply to other major health threats like tuberculosis? What's gone well that we should be applying to these other infectious diseases? Is Peter there? Oh, I don't know, I think we've lost him.
Hiya.
Oh, you're there. Brilliant. What can we learn from our approach to COVID for other diseases?
We have learned a lot from the community role in tuberculosis, and that is the referral system, how the referral system works. And it has worked very well where communities screen patients that are asymptomatic and refers them to the health facilities. We have also learned how the communities are the drivers of identifying those people who have been infected within the community. And I think that's a rich experience that we could have brought to COVID, where communities, having been trained and their capacity built, can be able to have a referral system, including transportation of sputum or any other specimens for diagnostics. And lastly, I think we can also build a system where we can develop community-based testing other than the healthcare, because the healthcare facilities are congested. So we can use that strategy of the community to have diagnostics that are community-friendly, so that this one can help us catch up a number of people who are symptomatic to COVID.
So outreach as well as people going to the health system is key. A very, very interesting answer. I want to just quickly move on to Hayat. A question about how would we validate coronavirus tests? How do we make sure that they're accurate? In lots of parts of the world, we've had unsubstantiated kits flooding the market that haven't been properly validated. Hayat, what do you think we need to do to kind of manage that risk?
Thank you, Sarah. For me, to ensure equitable and affordable quality vaccine, to all our member countries and to the world, definitely we need to focus a lot on technology and innovation, and especially the digital health. And we've been forced now to do everything digitally. So digital health and digital transformation will be one of the key area that we need to include in our package. And also advocate among policymakers the global health data governance principles, because you can see that with the cloud computing, Internet of Things, big data, blockchain, artificial intelligence, really they're playing critical role for monitoring, tracking, and enhanced prevention measure against spread of COVID-19. Also, the strengthen the whole supply chain in terms of the including of technology transfer, certification, manufacturing. It can monitor that, and also it can play a critical role to give you end-to-end type of monitoring. And it can also provide transparency, feasibility. All the stakeholders can be also make sure that their own different information is stored and managed in a better way. So the Internet of Things, the digital transformation, digital health is a crucial, and you can see from the two example I presented, without the digital health, and how are you going to connect 200 million people with a good logistic, transparent, end-to-end to the beneficiary system without having that digitalized and incorporated. So we are in the Islamic Development Bank investing heavily on digital health and digital transformation that include in our package in terms of our services and delivery and our recommendation.
Thank you very much. I think we've got time for one more question. So I'm going to go to Desiree again. How can and should the private industry engage with public partners to create the sustainable health system that everyone's kind of described? And what, if anything, is actually missing from our current approach?
I think there needs to be, the awareness is actually there. So the biggest issue is just making sure that the industry really engages and understands what are the main areas that they can invest in, explaining how the market can work. There are areas which is unfortunately market failures. So I do think that that's an area where co-investment of public and private players would be really important. And that's not only for research and development, but also when thinking about rolling out testing in facilities. I do think that, and there's another question that came up on IP. How do we make sure that that there is really responsible management of intellectual property that fosters the availability of tests and test and technologies that need to be there, reagents that need to be there to really make sure that these are available. I think that awareness needs to be definitely kept high. Use the momentum that we have achieved with COVID-19 to keep the industry engaged. Look for a wider, more diverse group of companies to really get involved from all over the world, and really look at good practices, best practices for how do you actually make sure that products are made available and the right capacity is actually brought into place, and try to promote those sort of good practices, so that way you see more investment coming forward.
Absolutely. I wish I could quiz you all of you more on all these issues, but I think we're running out of time. So let's move on and I'm sure these conversations can continue on social media afterwards. I think if anything though, that our comments and our discussions have demonstrated that yes, the pandemic shone a spotlight on a lot of testing, but we really can't let that lift because there's so much work left to be doing, whether around access, other diseases, etc. But to take these discussions forward, I'm really pleased to now introduce the Honourable Aminata Touré, who is the President of the Economic, Social and Environment Council of Senegal and former Prime Minister. She's also currently a Goodwill Ambassador for FIND, where she passionately champions equitable access to diagnostics. So, Dr. Touré, I turn the floor over to you to hear your recommendations and reflections. Thank you. Oh, I think you're still on mute. Brilliant, thanks.
I'm muted. Thank you very much. I really would like to express my appreciation about all the panelists, very good points. And I think the diversity and the angle each of them choose sort of would help us to express our recommendations to the meeting that is coming up. That is a very important one, the Global Health Summit that will be held on 21st May, and the 74th World Health Assembly. I think it's very important after all this very important and deeply thought high-level meeting that we sort of formulate and bring all these ideas together, to sort of reach out to those who are going to take the decision globally. Let me recall some numbers, but I think it's important that we recall, we are professional ourselves, we do know that. Myself, I work in reproductive health for 25 years with UNFPA before, going to government. But in 2020, let's remember that 1 in 5 health facility across Africa, where I'm sitting, only 1 in 5 had access to COVID-19 tests. Myself, I was impacted by this number. A good friend of mine, who was a great personality here, it took him 6 days to realize that he had COVID, and he passed. My own brother had to go to emergency because, he dragged this fever that looks like, the flu, and, spent 12 days in emergency room. Luckily, he recovered. So this number has an impact. And I think it's very, very important that we know that. In low and middle income countries, the most basic testing capacities is 1% of primary care clinics, 1%. And we do know that testing tools do not exist for 50% of the top 20 diseases worldwide. So we see the gap that we need to fill. It seems to me very, very, very important. I think that's Peter who recalled how his mother, used her experience to send him to the health center in case of malaria or suspicion of malaria. It shows us that if we really would like to achieve universal health care, testing is critical. I think it's very important that we express that, as a recommendation of our high-level forum. Let's remember the title: testing is the first line of defense against preventing future pandemics, and that is to be recalled. So we have to call upon the World Health Organization. I think it's not going to be difficult to do that because we have our good friend Theodoros who joined us, and thank you for being here too. But also we have to talk to the European Union, to the African Union, and the head of states from the G20 and the G7 Presidency. They must acknowledge that pandemics, preparedness, and response, as well as the attainment of universal health care. But I would like to say access to universal health itself. The point was made. I think by Sarah. I mean, it's more about care. It's about health as a whole. Rights. I think it's important that we frame it that way. And they have to acknowledge that if we want to reach that, we need a comprehensive, fully funded strategy for diagnostic testing. I think that is also very, very important that we look into that. I think it's also important that we have global collaboration for innovation, and we need also to coordinate agenda that are multi-sectorial. That's why I really appreciate how this panel was put together. We can see different angle, from Dr. Cindy, who is from the Islamic Bank, the Parliament, and also different other actors, communities, global institution. I think together that's how we are going to do that. And I think it's innovation and cooperation are really key in realizing that comprehensive policy, national and globally, as it relates to testing. And let me say also that it's very important that we build a real partnership that would help, really help, that would help countries in the South to develop and produce their own testing. It's not about just giving them the testing. They should have the capacity to do that. Institut Pasteur, which is a fully Senegalese institution, produce testing. Mazir, which is the foundation of Mazir in Morocco, produce also testing. So we should make sure that this cooperation reinforce self-dependent capacities in the South, so they can produce that. I think that is very, very important, and we have to salute the successful effort from the ACT Accelerated Diagnostic Pillar that is co-led by FINE and the Global Fund. And we have to make sure that it results in creating a permanent diagnostic alliance. That alliance, its main goal, as I said, is of course to steer up scientific collaboration, but also to sort of gather all the actors to reinforce self-reliance in test production in the South too. I think it's very, very important that we do that. Let's remember also that in alliance with the recommendation from the Independent Panel for Pandemic Preparedness and Responses 2021 reports, G7 countries, have to commit 60% of the $19 billion required by the ACT Accelerator in 2021. So it's important that that also occur. I think the meeting has to be really concrete. It has to lead to very concrete decision, and funding is, of course, one of the most important decisions that they have to achieve. But not only in the word, but in also putting their hands in the pocket and putting the money on the table. So I think that is very, very important when it comes to international cooperation. This will really help research institute, diagnostic developers, manufacturers, healthcare workers to really be able to create a roadmap for sort of suitable and sustainable diagnostic system. That is very, very important for us. If for all the diseases quote to quote like malaria, we are still sort of having the issue, let alone the emerging and the upcoming pandemics, we have to get prepared to that. So if we are prepared to that, I think we will be prepared to handle the best way the upcoming pandemics, because that's the world we live in. I think it's also important that really we sort of stop this highly dependency on a small numbers of countries that manufacture diagnostic tests. And within those countries, we have seen the fight around masks, the fight on still going. I think, the intensity is lower now around, vaccine and etc. So I think that has to stop, because otherwise we are in market sort of based decision and strategies, and then we lose lives, in between. So this testing nationalism and broken supply chain demonstrate the need for change in manufacturing toward a more focused, resilient, effective approach, and based on solidarity, and also with the objective of making sure that countries can help themselves. Sitting here in Senegal, I think it's possible, because we have done that. As I said, the foundation of Maastricht did that also in Morocco. So I think that's the way to go if we want to have universal access to testing. We need also to support the development of national essential diagnostic list. I think it's important. It's based on WHO list, and it has to be funded by national action plan. That's where, what is going to be discussed in Rome has to come down and be owned by countries and reflected within the health budget. That is very, very important that we do that, because what we are seeing is sort of a rush now to secure vaccine, which is important, but we have also to take this opportunity to support testing for COVID, but testing per se itself. That's an opportunity. That's a few opportunities that COVID is giving us, actually. After all, we went through 1 million of people died and etc. But let's take it as something that could, help the other diseases. That testing is the number one, sort of priority, along, of course, with so many. But that one tend to be forgotten, and we have to sort of make sure that the leaders that will get together will hear that. We have to also recognize, and I think it was said when we talked about community intervention, we have to recognize that testing doesn't only occur in the health system. It has to also be integrated in the society as a whole. I'm thinking about the schools, the workplaces, the border crossing, transportation, wherever you can quickly know whether we are in a safe place or not, let alone self-testing beyond healthcare setting. I think it's very, very important. If we saw the scale and the numbers that got infected of COVID, of course, it has to be really, we have to make sure that people can help themselves. Countries should help themselves. People should help themselves very quickly at a very affordable cost. That is something that also we should sort of put forward. It came out of the different intervention we heard. I think it's also important to support innovating digital health solution. In Senegal, that was really helped in terms of facilitating diagnostic. Now your results, you get them when you want to travel. Your test, you get it, in your phone. But it should not only be about that. It should be about the whole chain. I feel the symptoms. What do I do? I can quickly, sort of using digital devices, get informed and know what to do. We have to use artificial intelligence. I think it's important. Mobile monitoring device, etc. All the self-testing tools that lend themselves to digital mode. It should be really supported. And this is something that speaks to Africa, because I always recall that we have more cell phone than the US and Canada combined in Africa. People don't seem to realize that. So it's a great tool that lends itself also to the topic we are talking about. We also have to build diagnostic literacy among policymakers, starting by politicians themselves, politicians like me. They are the ones voting the budgets. We have to advocate for a specific budget line in health budget when they come to the parliament to get the vote for their budget. We have to make sure that that line is there, and it's important that we recall that also to decision makers. And I think it's important that we get community involved, media, especially in low and middle income countries, to sort of enhance the confidence and the understanding of why we're using testing, because we still are dealing with stereotypes, wrong ideas about whatever gets into your body or whatever lends itself to you giving something that you don't know where it goes. That's because unfortunately we do have in the past very sad experience of substandard research and things like that. So I think we need to really reinforce public confidence and in all aspects in order to tackle this issue of testing. That is again the key investment for pandemic preparedness and response, and also for achieving universal health care or universal access to health as a human right. Thank you.
Thank you so much. What a fantastic wrap up of all of the ideas that we've talked about, and a true call to action for world leaders. I think what you say about building literacy in politicians, Sarah mentioned it earlier, but how important, as we've heard, testing really is the linchpin in this pandemic, but also to address future health emergencies, and capacity in part of the globe is just not enough. We need to really roll that out more broadly even. So just to reiterate, the recommendations for the World Health Assembly and world leaders, which Dr. Toure touched on, have been shared in the chat, and they'll be emailed to you afterwards and also published on the SIGN website. To close, what I hope you all agree has been a very engaging and insightful discussion. I want to hand back to Dr. Sergio Carmona. Over to you, Sergio.
Thanks, Sarah. Good to see Bill's cameras on. And today is also a really important event for FIND. I want to take the opportunity to introduce an old friend, colleague, as the new CEO, Dr. Bill Rodriguez, who will be joining FIND officially from the 1st of July. Bill is returning to FIND. He was previously the Chief Medical Officer between 2015 and 2017. And in between, he's now been at the DRK Foundation. He's a medical doctor with extensive experience across both private and public sector. He has been an entrepreneur and founded his own diagnostic company a while back. He's, needless to say, highly respected figure in global health, served as an advisor at WHO, at the Bill and Melinda Gates Foundation, both national governments, and we've worked together in the past, on HIV and other infectious diseases. So, Bill, what can I say? Welcome back. I look forward to you joining us the 1st of July, and the whole of FIND is eager to see you arrived here. So why don't you take the opportunity also to conclude with some key messages for all of us? And yeah, thanks for joining this meeting ahead of 1st of July. Over to you, Bill.
Yeah, thanks so much, Sergio, for that warm and heartfelt and not quite brief enough introduction, but I appreciate the accolades. Before I actually get to these two brief remarks that I'll make, I just want to reiterate what Sarah said, just express my gratitude for the organizers of today's event. It's obviously a very important event for FIND as we launch our new strategy. The opening remarks that came from the Director General and Peter Sands, and the quality of the discussion led by the panelists. I was just looking through the 25 or 30 questions in the chat box, and I'm just impressed at how much depth and engagement and critical questions are being asked. And obviously, we just barely scratched the surface on some of those today. So I'll look forward to engaging with many of you in the future as we try to continue this discussion and really try to deliver on the promise of testing around the world. I'll keep my remarks brief. I know the hour's late for many of us, and I'll just have two brief remarks. First is just to introduce myself to those of you who don't know me. My name is Bill Rodriguez, and as Sergio mentioned, I'll be coming in to FIND as the incoming Chief Executive Officer on the 1st of July. It's great. It's gratifying to see so many familiar names in the participant list today. I'm looking forward to renewing some old friendships and partnerships and some new acquaintances, and there's many of you who I don't yet know, but look forward to getting to know when I arrive to FIND in just 7. And I'll look forward to this ongoing discussion. The second remark I want to make is just calling back to something that Peter Sands said early on in 90 minutes ago in this high-level forum. He mentioned, I think, that he'd learned more about testing in the past 15 months than he ever thought he would know in his lifetime. And I think that's an important and telling remark. And if you recall, when SARS-CoV-2 was first identified, it took 13 days to develop the first PCR test, the qualified PCR test, which in the testing world, as many of you know, is breathtaking speed. And it parallels the breathtaking speed we saw in the development of COVID therapeutics and COVID vaccines. And I think it speaks to the power of what can happen when you provide resources and attention and a global focus on delivering a promise around better health, including testing. And yet, I think we would all acknowledge that this exhausting effort led by many of you trying to develop and deliver and provide access to testing for COVID around the world. We can all look at where we are today as the pandemic continues to wreak havoc across our communities and recognize that as much as we can celebrate the successes of the past 15 months, we're not there yet. And there's an enormous amount of work ahead of us that has to be done. And as much as we want to rest on some of the successes that we've seen in testing, it's too early to rest in this pandemic for sure. And to think back to what Peter said about testing as the cornerstone of both public health and patient care, we've learned that that's true not just in COVID and not just in pandemics and global health security, but we're now clear that that's a critical element of the entire health enterprise. And that's why these two pillars, that's a big part of the FIND strategy that we're launching today on global health security and on universal health coverage are so, it's hard to separate those two. And then I'll just end by reflecting on the second thing that Peter Sands said, which is it's not just about testing, it's about partnerships. And I think we've seen the power of working together in partnership with communities on the ground, with advocates, with organizations around the world to try to deliver on this promise. And I think while we're not quite there, we can agree from today's discussion that there's a shared vision that we can strive towards equitable, affordable access to testing for everyone, not just for COVID, but for all conditions. And so I'll look forward to joining everyone in just a few weeks and helping guide us through that effort as we embark on this new strategy over the next few years. Thanks, Sergio, for the warm introduction. Thanks to everyone who participated today. And I'll turn it over to Sarah for final closing remarks from the forum.
Thanks very much, Bill, and I'm sure everyone's very excited to be working with you. And as a journalist, I look forward to seeing what you and all of the members of the panel continue to do around testing over the coming months. There's obviously a lot of work to do, and I'm sure we'll be asking you all many more questions in the coming months and years. So today has been an incredibly engaging conversation with lots of ideas. We've covered a lot of ground. I hope you continue discussions on social media with that hashtag transforming testing. And don't forget to check your inbox for recommendations for the outcome of the event. With that, I'll end it. Thank you all for joining us. Have a lovely day, or what you've got left in it, depending on the time zone. And look forward to seeing you next time. Thanks, everyone. Bye.